64-year-old pensioner Joyce Mtsweni has stayed in this area for 15 years. She suffers from asthma and arthritis. Getting to a hospital is very difficult for Mtsweni as she can barely walk.
I pay a lot of money for special transport to hospital. I can't use public transport. This area we live in is not conducive to our health as elderly people.
The welfare of the elderly is not just government's responsibility, but also of communities.
Many things that ordinary citizens can do to make life better for the elder person and to take care of them, and not just to go and dump them in an old age home and forget about them.
For now, elderly people like Mtsweni hope such recommendations are taken seriously and make a difference to how they are treated.
So South Africa has seen an increase in life expectancy in recent years. In 2015, there were about 4.2 million people over the age of 60. Now, this constituted approximately 8% of the total population. Now, this figure is projected to almost double and reach 14.8% by year 2050. However, the consequence of living longer is an ever-increasing demand for healthcare services. Now, this is because as people get older, there's a lot more chronic and age-specific diseases and disabilities. So how well do we care for the elderly? Is our healthcare system adequate enough to take care of the healthcare needs of the elderly? What part can you at home play in taking care of the elderly? Well, October 1st is International Day for Older Persons. So today we discuss geriatric health. We have a geriatric care team made up of a geriatrician, nurse, and occupational therapist to help us understand common health conditions affecting the elderly, their causes and risk factors, how to prevent common accidents, take better care of and improve the quality of life of our senior citizens. So sit back, relax, and learn from this exciting show ahead. Your questions and views are always welcome, as always. Now, the telephone number to reach us at is Johannesburg 714-6841, 6842, or 6843. Or you can also tweet us at SABC Health Talk, or simply interact with us on our Facebook page, SABC Health Talk. I'm Dr. Sello Mutaung, and this is Health Talk.
As most people get older, their bodies start to wear out, and they begin experiencing more health problems. As a result, elderly people often need more medical care than others. Geriatric nurses are some of the most important professionals in this field, as they often provide daily care for geriatric patients. Macy Qaleka, a geriatric nurse, also known as Macy May, shared with us more about her profession.
It's to look after the old people. You look after them generally. You feed them, you see that they are clean, you see that they have their medication in time, everything.
Dementia is defined as a decline of cognitive functioning of the mind, eventually resulting in deterioration of both the mental and physical status of the sufferer. Psychiatrists play a vital role in assisting the elderly to manage dementia.
Dementia is the death of some cells in the brain. So she will be visited by her child, but you know who has visited her. Or she cannot laugh, you will say laugh, then she will start laughing. You put food in front of her, she doesn't know what to do with the food.
Studies estimate that up to 40% of people with dementia suffer from major depression. It is sometimes difficult to see symptoms of depression from the elderly as they do not talk much or smile a lot.
With the depression, it's very difficult with the depression because some, they don't even talk. Some of them, they get aggressive, but you've got to cope with those conditions. And you same as the dementia, they are referred to the doctors and you state that she's aggressive or whatever, then the doctor will prescribe something.
Combination of complex medical conditions may lead to the need to take multiple medications, with some elderly people taking on average 7 to 8 medications a day.
Give them their medication at the meal table. For breakfast, we give the medications at the table whilst they are eating. And you've got to see to it that they take it at the same time you give them. At lunchtime, we give them if they are to get the medication 3 times or 4 times or 2 times a day, you give them at the table.
It is very important to ensure a safe environment for the elderly, treat them with respect, and help them to maintain their dignity. Allow them to complete tasks for themselves, such as ordinary activities of daily living.
To the people who are looking after elderly, you've got to have love for them. They must feel that love. And you've got to be with her all the time and ask her. Sometimes they forget even that they didn't wash their teeth. Sometimes it gets aggressive when you say, you didn't wash your teeth. But you've got to smile. And she will see from you smile and she will go down.
Smile indeed. Okay, to learn more about geriatrics, it's a special pleasure, great pleasure for me to welcome on studio Dr. Stanley Lipschitz, who is a geriatrician in private practice based in Rosebank. Welcome to Health Talk.
Thank you. Thanks very much.
I might as well just add, by the way, Dr. Lipschitz is also senior lecturer at West University and is also president of the South African Geriatric Society. Now, perhaps let's start with the basics. I mean, obviously, we say today is International Day for Older Persons. What do we mean by an elderly person?
Okay, so you can either define an elderly person based on age, or you can describe an elderly person based on a presentation.
Right.
In South Africa, because we have so few specialists in older care, we prefer to define it in terms of a clinical presentation.
Right.
So it's based on a physiologic decline,
Okay.
which occurs in all of us.
All right. We're going to come back to actually what happens.
Yeah.
But let's, we've been using some fancy term, geriatrics,
Yes.
geriatrician. Can you just take us through what actually that means?
Okay, so in, I guess, first world country, over 65 would be geriatrics. In South Africa, it would be out at 75 more.
Yeah.
But it's more a person who presents with multiple chronic illnesses,
Okay.
person on multiple drugs,
Right.
person with frailty, falls, memory problems.
Okay. So as we get older, I mean, in my introduction, I said,
Yes.
you have more diseases, age-specific diseases and disabilities that tend to creep in. What actually happens to our bodies when we get older?
Okay, so for the audience, it's a bit scary because you actually start to decline physiologically from about age 30. So you start to lose functional reserve. You see, you reach your peak in your early 20s, and then you maintain your function till about 30, 35, depending on the organ. And then you start to lose function in the organ by about 0.5% to 1% per year. So if all of us reach the age of 80, you will, by definition, just as a part of aging, have lost about 50% of your function. Now, that loss of function is then accelerated by 2 factors. Number one, intercurrent illnesses. So, for example, if you smoke, your respiratory function will decline at a greater rate. If you have cardiovascular disease or hypertension, then your heart function will deteriorate. So, depending on what your general disease state is, you may accelerate your loss of function. And then the final one is lifestyle. So if you live in a sedentary fashion, you don't eat the right foods, you drink too much alcohol, you smoke too much, and you don't exercise, you will accelerate that physiologic decline. What's happening is you're declining towards a threshold of function. And that threshold is a point where you can either do something or you can't do something. So for example, with mobility, You can't sort of walk. You can either walk or you can't walk. And if you lose enough physiologic function, you will reach a stage where your mobility is impaired, and then you're at risk of falling. Similarly with functional ability. You'll decline towards a threshold to a point where you are no longer able to function in terms of your daily activities, like bathing, feeding, washing, dressing, and your more extended instrumental activities of daily living.
Right. So in essence, what I pick up from what you're saying again is that age only is not, what defines what geriatrics is, because it's your functioning, it's your quality of life, as it were. Now let's talk about that part now, where healthcare is necessary. For instance, the geriatric syndrome. What is that? The frailty syndrome. What is all that?
Okay, so frailty is where your functional capacity becomes impaired. It's defined, in practice, we define frailty as an elderly person who has lost body mass, and that implies that you're losing muscle. We call that term sarcopenia. So if you lose 5% of body weight in an unexplained way, that's one of the defining characteristics for frailty. The second defining characteristic is loss of body mass or muscle mass. The third one is just a complaint of exhaustion, generalized exhaustion. And then the final one is decreased ability to walk one street block, or to climb one flight of stairs. And if you've got two or more of those characteristics, you're defined as frail. Now, frailty defines a vulnerability. If someone's frail, basically their outlook in terms of function and in terms of survival is severely compromised. And the whole practice of geriatric medicine is to attempt to either prevent frailty, or if somebody is pre-frail or frail, to try and intervene in a medically and rehabilitative sense.
So talk about geriatric care then. I mean, is our healthcare system attuned to that? I mean, do we have enough resources? Do we have enough personnel? Do we have enough, even the personnel that we have, do they have the right sort of, knowledge to take care of the elderly?
A simple answer, no. We're unfortunately a society where we don't have specialist training in geriatric medicine in most medical schools, nursing schools, occupational therapy, physiotherapy, or biokinetics department. So we tend to focus predominantly on the young and middle-aged and maternal health, and the elderly get forgotten somewhere along the line. There are, for example, about a dozen geriatricians in the whole of South Africa, specialist geriatricians. We're trying to address that, but there's lack of funding for posts. There's perhaps lack of interest from the medical model. There's lack of interest from doctors to do the specialty.
All right, I think this is just a good point to break for a moment.
Yes.
We'll continue that discussion after the break. So after the break, we now look at perhaps, get into chat about a few more of those common conditions affecting the elderly. That after the break. Please stay with us.
Shield Medical Scheme. We don't just talk health, we do health.
So good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
The decision to reappoint Dudumyeni to chair the SAA board was again heavily criticized by members of parliament.
Tell us whether she still believes that it is in the best interest of the airline that she doesn't resign.
We're satisfied that we have the necessary skills to take the airline forward.
Myeni, who arrived almost 2 hours after the meeting started, offered to answer in writing.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
Welcome back. We're talking geriatric health, and with me in studio is my special guest, Dr. Stanley Lipschitz, who is a geriatrician in private practice based in Johannesburg. Now, let's carry on. I mean, I did say that we need to perhaps be a bit more specific now, talk about some of those common health conditions affecting the elderly. Perhaps starting with, functioning of the mind.
Okay, so as you age, obviously your functional reserve in the mind decreases, and as such you're predisposed to either acute or chronic brain failure, if you like. And brain failure is a major problem. If it's acute brain failure, it's called delirium. And delirium is almost a medical emergency because the outcome is extremely severe in terms of long-term disability and
what would be the
infertility.
typical, symptoms there?
Well, there are two kinds of delirium. There's the agitated delirium or the apathetic delirium. The apathetic being more difficult to recognize in practice and in fact with worse clinical outcomes. So those patients sit very quietly in the ward, they're non-communicative, they're basically sitting in their own world, they're not interacting. The agitated delirium is the classic patient in the hospital who starts beating up the nurses, gets very agitated, very angry, very aggressive. Both forms are dangerous. The agitated one is of course easy to recognize. The apathetic is much more difficult to recognize, but both need urgent intervention. So generally you've got a compromised brain and then you've got a superimposed acute illness, which may be anything. And that results in the acute brain failure.
Okay, let's talk a bit about dementia. I mean, there was talk of dementia then, yeah?
So dementia is chronic brain failure. Dementia is basically defined as a loss of memory together with a decline in several other cognitive functions, concentrations, executive functioning, practical ability, speech and language.
I mean, we all are forgetful, I mean, there's obviously grades that you're talking about.
There's grades. So, a decline, if you look at aging, when you're young, I don't know if you remember, you can remember the whole page of your medical book. As you get older, your ability to rote learn like that tends to decrease, but your ability to understand the broader perspective improves. It's almost like your memory is maturing like the rest of you.
Right.
So as you get older, forgetting somebody's telephone number or forgetting their birth date is common and really not to worry about. When it starts to get noted and noticed by those around you, or when it starts to interfere with your function, then it's significant. An isolated problem in memory is called mild cognitive impairment, as opposed to a combined memory and global cognitive disorder, which is dementia. Once you then have dementia, that's a very brief description, you then try and classify what form of dementia it is. Is it an Alzheimer type dementia? Is it a vascular dementia, a mixed dementia, a Parkinson's dementia, Lewy body dementia, frontotemporal? There's a whole variety depending on the clinical presentation.
All right. And of course, there's a possibility of other psychiatric conditions, which you don't have time to get into. But perhaps let's come back to the other important one, falls.
Yeah, so falls, it forms one of the atypical presentations of disease in the elderly, and it's a manifestation of lack of functional reserve. So what you're closer to that threshold of functioning, and as you dip below, you present, in this case, with falls. So falls are very common in the elderly. They're often unrecognized. Oftentimes the first fall doesn't cause an injury, but subsequent falls will cause an injury. And also they're associated with a kind of loss of confidence. And therefore it's almost like falls beget falls. So once you fall, you get more circumspect about walking, and then you get more falls. Obviously, the causes of falls are multifactorial. It relates to the physiological change, and then superimposed on that, either any acute illness. So oftentimes a bladder infection can present with a fall. Chest infection, an abnormality of your blood chemistry. Most often it's a combination of factors, and then the big one that's often unrecognized is a drug.
A drug. Well, let's talk about that. I mean, we said that, the elderly oftentimes are on multiple drugs.
Yes.
Not because they wish, well, in most cases, not because they wish to be on multiple drugs because of the, other conditions that they have. But drugs tends to be a problem in the elderly often.
Yeah.
Take us through that.
Yeah, as we discussed earlier, elderly people often have multiple diseases. So they've got cardiac disease, they've got chest disease, they've got arthritis, and they've got bladder disease. And oftentimes you treat with one drug, and that drug will cause a problem in another organ. So for example, you give a water tablet to treat cardiac disease, the patient has arthritis of the knee, then the patient can't get to the toilet in time, so they become incontinent. Then you give them another drug to suppress the bladder function, and that drug may then affect the brain function. So you have interaction of drugs with other drugs, and drugs with the individual, and drugs with diseases.
Is there a problem of abuse of drugs in the elderly?
Yeah. Obviously painkillers. I mean, painkillers, the problem with analgesic abuse is rife. Very often in the elderly, they've got multiple causes for pain, and then they go either onto anti-inflammatory drugs, which, as you know, can affect your kidneys, your heart, your gut. And then other drugs of abuse, in particular codeine-containing analgesics. And codeine dependence is rife amongst the entire population. Yeah. But here you've got a very vulnerable population, and that increases your problem.
All right. Okay, we're going to go again for a quick commercial break, and when we come back, we're now going to look at some of the causes and risk factors for some of these common conditions that we discussed just now. Please stay with us.
If we're talking health, then let's talk seriously.
SABC News on point with news around the world. Live transmissions to keep you informed. When history unfolds, we're there.
At which Clinton and her supporters painted an optimistic portrait of America. Statues of the woman who led the march to the Union buildings in Pretoria in 1956 have been unveiled against the walls of the State Theatre in Pretoria. Sophie de Bruyn, Lillian Ngoyi, Helen Joseph and Rahima Musa led 20,000 other women to the Union buildings against the Dom Passers in 1956.
It is for the youth to take the baton that we have already handed over to them.
What has happened to South Africa? Utheni my postcards.
Stay tuned to News Today at 3 p.m. from Monday to Friday on SABC News.
Shield, embracing our members in good health since 1968.
Welcome back. We're talking geriatric health care, and with me now in studio, it's still Dr. Stanley Lipschitz, who's a geriatrician, and we're joined by two other special guests. First up is Sister Liz Ferrell, a registered nurse at Isisa Health Care, and she's not just a registered nurse, but also a midwife. Welcome to Health Talk, Sister Liz.
I beg your pardon?
Welcome to Health Talk.
Thank you so much. It's good to be here.
All right, and on the extreme right is Cindy Kashula, who is an occupational therapist based at Johannesburg North. Welcome to Health Talk as well.
Thank you very much.
All right. Perhaps let's start with you, Dr. Stan. Now, we were talking about, obviously, some of these common conditions, and, starting with falls, perhaps. Yes. The common risk factors, all right? You mentioned earlier the issue of, loss of muscle mass and osteoporosis. Yeah. Let's just spend a few minutes on that, yeah?
Okay, so the fall occurs because of multiple factors.
Right.
One of which is loss of muscle mass, which we call in medicine sarcopenia, which inevitably occurs with aging. So you have decreased functional reserve, therefore you fall.
Right.
Part of the treatment and management of falls obviously is to define why the person's falling.
Right.
So is it because of generalized weakness? Is it because of a secondary cause? Or is it because of the activity that the person's doing? In other words, standing on a step ladder trying to hang curtains or something.
Yeah. Oftentimes some would complain about dizziness. Could that be one of the other reasons?
Yeah, dizziness is a common complaint amongst the vast majority of patients. And once again, there's very seldom one specific cause of dizziness.
Right.
It relates to problems with cognitive function, with vision, with middle ear problems, with proprioceptive problems, with joint problems, cardiovascular output, perhaps blood pressure dropping as they stand. Well, that's one of the challenges of geriatric medicine, is taking a specific presentation and then defining a dozen or half a dozen different causes and then intervening where you can. We have a thing called the principle of small gains. If you can treat one tiny thing, then you make the entire person a little bit better.
Okay, let's invite Cindy here. Cindy, talking about falls, there's clearly issues at the home environment or the work environment that may be risk factors for falls. Just take us through some of them.
Yes, so definitely it is very important to look at the home environment, and not just the inside of your home, but also the outside of your home. So risk factors might be loose mats, especially the bathroom would be a major risk factor, so looking at always keeping the surface dry, and then also looking at, for example, what Dr. Lipschitz also say is climbing steps. Are there steps in their home? Do they have rails so they can hold on to balance themselves when climbing over steps? Then outside, you always want to look at the surface also. Is it uneven? Is it smooth? When it rains, is it safe to walk? So it's very much the structural side of risks that will cause a fall.
All right. Sister Liz, we spoke a little earlier about, the problem of dementia and cognitive functioning. Clearly, there are certain issues at home that may either, worsen that or, bring upon some of these problems. Your experience?
We care for patients in their homes. We found that it is just far more favorable and satisfactory to keep them in their home environment.
Yeah.
As Cindy and Dr. Lipschitz says, you have to safe plan the house so that at least you have a safe environment where they can function, and to ensure that they can use themselves to optimal, or they can function maximally in this environment.
So perhaps linked to that, Dr. Lipschitz, is are there other factors that can perhaps in fact worsen dementia and cognitive functioning in general?
Yeah, any intercurrent illness or intercurrent insult can worsen dementia. So if you have cardiac failure, for example, you're not pumping enough blood to the brain or not pumping enough oxygen to the brain. If you have respiratory difficulties, you're not getting enough oxygen through. If you have any intercurrent illness, nutrition is important. Malnutrition is rife in the elderly. Drugs, as I mentioned, there are numerous drugs which cause cognitive impairment. The ones that we're particularly worried about are drugs to treat bladder dysfunction. So oftentimes we give a drug to reduce the bladder contraction. Those are called anticholinergic drugs, and they block a chemical called acetylcholine, which is the very same chemical that works for memory. So if you block the acetylcholine in the bladder, you also block it in the brain. Common drugs used for the gut to decrease cramping cause confusion. Simple old cough medicines, common cause for confusion. Drugs that we use for some of the antidepressant drugs are powerful causes of confusion. So it's incumbent upon whoever is caring for an elderly patient to get a comprehensive list of every medicine that the person is taking, including the medicines that are over the counter, and then define exactly whether there may be a negative effect of the drug and whether there may be an interaction with another drug.
Okay. Sister Liz, there's the notion of mental stimulation. How important is that?
Very, very important.
Right.
You have to keep them stimulated. And it doesn't have to be anything dramatic. As long as they do something meaningful every day, whether it's building a puzzle or playing cards or going for a walk around the garden with help or assisting to make their meal or anything that encourages them to achieve something so that they have the satisfaction of knowing that at least they can still do something. It's very important.
Okay. Cindy, we all know about the benefits of physical activity. But oftentimes, as we all know, physical activity levels tend to decline in the elderly. What are those factors that tend to promote that decline in the home environment and anywhere else, I guess?
So I think it very much links up with what Sister also said, is that the meaningful activity of it. So to just say to an elder person, you have to exercise, is not necessarily motivating them. So when you combine that with a social activity and say, let's at the home where you live or in your friendship group, get together and do exercise together, because then you're also stimulating their social interaction, you're making it enjoyable for them. And as an added bonus, they are getting some physical activity. So definitely not isolating them, but bringing them into a community of support.
Okay. I mean, the whole question of neglect as a risk factor for especially mental illnesses. Your comment on that, Dr. Lipschitz?
Well, we're in a situation in South Africa where we very often have elderly people living alone. Certainly in one part of society, you often have the nuclear family eroded. You have children living overseas often. You'll often have an elderly person living in complete isolation with very little contact with her children. Financially, there are difficulties with paying for care, and that extends throughout South Africa, not privileged or unprivileged. So you have this problem of isolation. As a consequence, you don't have adequate stimulation. As a consequence, you don't have good nutrition. You often have an elderly person who perhaps is able to get out, but is a prisoner in his or own home because of safety reasons. Personal safety and obviously safety from outside. So you have this condition of isolation.
Okay. Okay, let's at this stage take Jessica from Johannesburg. Jessica, hello and welcome to Health Talk.
Good morning. Doctor, I would like to know if tablets like Arapax and Rivotril have they got side effects for a person who's in their late 60s?
Okay, well, let's get the response from Dr. Lipschitz. Doctor?
Yeah, very much so. Look, one mustn't throw all drugs out. Your drugs have a specific indication, and when used appropriately, they are good. Rivotril is a very powerful sedative benzodiazepine drug. It's sedating, it causes confusion, and it can cause falls, and it should be used with great caution. Please don't stop your Rivotril straight away, because it's a highly addictive drug, and you will have an acute withdrawal syndrome. But you really should, if possible, speak to your healthcare specialist or your general practitioner and discuss ways of perhaps weaning and then slowly discontinuing the Rivotril, and perhaps considering an alternative medication. Oftentimes, drugs are used in the elderly because they've just been used for many years.
Yeah.
So a drug started in young age, perhaps because of a sleep disorder or because of slight anxiety, and then you just carry on with it.
Well, it talks to dosaging as well. I mean, should there be any adjustment in dosages when it comes to the elderly?
You know, those sorts of drugs should preferably not be used. Other drugs, for example, antidepressants, you talked of Arapax, the dose is the same in the elderly, but just as a general principle, we advise start low, go slow. So in an older person, the final dose needed is the same as for a young person. Okay. But you start at a lower dose and you slowly titrate the dose up.
All right. Okay, it's time for another quick commercial break. After the break, we'll now look at how we care for the elderly.
Shield Medical Scheme. We don't just talk health, we do health.
Certain choices in life lead us not to our destination. Prostitution will not.
Everything that I used to do then, it was something that I never thought of, I never dreamed of.
One bad choice in life led her to another.
Most of my clients, they used to ask me a question, what am I doing in that industry? Because it does not suit me at all.
Her demons haunted her until she changed her life.
I used to pray that, Lord, if you can deliver me from these drugs, I promise you that I will serve you for the rest of my life.
She has since found peace and is serving her community.
We'll try by all means to spend time with all of our kids.
Join your host, Buleng Mulabati, every Friday at 17:30.
The Flower Foundation is an organization that caters for the needs of those over 55 who are seeking to retire to a safe and secure environment with available care facilities for health care needs. The foundation has several mid-care and frail care centers which are designed to cater and care for the needs of the frail elderly. Elaine is the matron at Pioneer House. She explained to us the process of being admitted to the Frail Center.
People come to us from different places. They either read about us, we've got a website. Most of all, it's from references of people that were here. So you can come, you make an appointment, we take you through the facility. And if the person can't come to me, then I go to whoever's interested and I do an assessment to see if you are fit for this unit and on which side of the unit would you come. Are you still independent and can you do for yourself still, or do you need 24-hour care? Then there's a lot of documents that you fill in. It's not a difficult procedure. The most difficult of it all is to decide, are you fit for this unit and on which side of the unit?
Living in a care center is essential for those who need 24-hour support. The Flower Foundation provides tailored live-in care to suit the needs, wishes and desired outcomes of the patient and their family.
There is 38 patients or residents on the frail care side, but there's 9 nurses and a registered sister. On the independent side, there's 40 people, but there's 2 carers and 1 staff nurse. So you can see the balance. There's much more carer people on the frail care side. My frail care people are really frail. They're what we call babies. You pick them up in the morning and you do everything like you would for a little child. You've got to keep them busy. And care for them. A lot of them are dependent for all their what we call active daily living. So it's like caring for a child.
As people age, their diets may need to change, especially if not well balanced. Generally, doctors and dietitians will recommend a well-balanced diet for older adults.
we have all the different diets that you need to be. There's a normal healthy diet, and then you might have a cholesterol diet, or you're a diabetes person. So we have our different diets. But the main thing is that in your 24-hour diet that you have, you've got to get everything you need, and my people do get it.
As an older adult, regular physical activity is one of the most important things you can do for your health. It can improve many of the health problems that seem to come with age.
Exercise and movement is very important. So let's do the frail care side first. Whatever activity you do, you try to put movement in it. So this morning it was supposed to be a music activity, but you get them to move within the music. When you shower someone, when you wash someone, that's on the frail care side. The moving of the limbs, it's all part of working.
When you're looking for a home for your loved one, it is important to point out that each care facility has their own definition and classification for what they call frail care, mid-care, and assisted living. So, it is important to discuss the nursing requirements of a family member with the care facility before admitting them.
All right, before we continue our discussion with our geriatric team, we still have, of course, that team made up of Dr. Stanley Lipschitz, geriatrician, Sister Liz Farrell, registered nurse, and Cindy Kashila, occupational therapist. We're going to take a call from Mona in Johannesburg. Welcome to Health Talk, Mona.
Okay, can I carry on?
Yes, please.
Hello?
Yes.
Okay. I want to just know, I'm a 74-year-old, very healthy pensioner. I had my cataracts removed about 1.5 years ago, but I'm now taking Altroxin, and I just want to know, I think it's for the thyroid. I take my blood pressure, which is Forza, I take Asvapor, I take Altroxin. But I just want to know, doesn't this stuff affect your eyes?
All right. Thank you very much. Thank you very much for your question, Mona. Let's get Dr. Lipschitz to respond.
No, thanks for the question, but no, they don't affect your eyes. Your thyroid medicine is essential because if your thyroid's underactive, it has a variety of very serious consequences. Similarly, your blood pressure medicine is important to protect your brain and your heart and your kidneys, but none of those are going to affect your eyes at all.
Okay. All right. Now, in that clip that we saw, clearly, I mean, shows one side of geriatric care, a home-based,
institution.
An institution where, they take care of, the frail and, the so-called old age homes. But there's also the other bit where people actually live with their family members at a home. And of course, the other extreme is, as you mentioned earlier, those that are often neglected and tend to be alone. All right. So let's talk about that in broad terms. Perhaps before that, Sister Farrell, Isisa Health Care. You mentioned that it's home-based care.
Home-based care.
What exactly do you do?
We care for people in their home environment, whether they live with a family, whether they live on their own.
Right.
We provide care in the home environment.
Right.
And it is often, or most times, preferable to keep old people in an environment that they're used to and an environment that they are familiar with. It is often difficult to do that because, as Dr. Lipschitz said, they might need a place of safety and it's not safe, or they might need more advanced care which we can't give at home. But try as hard as you can to try and maintain the living standard in the home environment.
Mm. And are you a private institution?
We're a private institution.
Yeah.
We work with all the other institutions because obviously we work on a referral basis. Mm. But the need to care for old people, specifically at home, has increased 100-fold over the last couple of years.
Mm. All right, let's take another call. Enoch from North Tex. Enoch, welcome to Health Talk.
Thank Thank you, Doctor. My question here, I'm 65 of age.
Yes.
I'm taking Donacept, which were given to me due to the little bit of loss of memory sometimes. So now I just wanted to find out, because if I did not take them, I'm okay. But it causes the muscle twitch. Is it normal?
Did you get the question?
Yeah, he's using Donacept, which is a generic drug of a drug that I spoke earlier about, acetylcholine, which is a memory chemical.
Right.
And Donacept increases the levels of acetylcholine in the brain. And obviously the aim is to improve memory or to improve functioning for longer. It's indicated only for patients with dementia, specifically Alzheimer type dementia. So, before you prescribe that drug, you need to be pretty certain of the diagnosis. It's occasionally used off-label for other memory problems. Like any drug, there are a whole variety of side effects. Specifically agitation, nausea, a runny nose. Sometimes it has the opposite effect to what it's supposed to, so it can cause agitation, worsening confusion. So some patients do very well on it, some don't. Really, if you're benefiting from the drug, it's certainly worthwhile taking. It's the only class of medicine. It's one of several drugs, but it's the only medicines that we really have, together with a related compound called memantine, to improve or to maintain cognitive function.
Yeah. But that obviously would be something between the doctor and the patient, as it were.
Yeah.
All right. Cindy, let's talk about, we're getting a bit more practical now, moving more, at least focusing a little more on those elderly patients or people that are at home. Now, in a home sort of environment, just general tips in terms of, what can be done to, perhaps let's talk about improving physical activity from your perspective.
So definitely physical activity. To encourage that, I would definitely encourage people to look at a routine, a daily plan, because what we see with clients is they stay in bed for prolonged periods of time. So then to initiate any movement takes a lot of energy and effort from them. So definitely scheduling into your program daily exercise. If it's walking around your garden or doing gardening itself, is also physical activity. Something like washing the dishes, being able to stand for 20 minutes while washing your dishes, that is physical activity. So it's not necessarily always just going to an exercise group or going for a walk around the block. It's sometimes the physical abilities you get while doing your daily activities. Showering for itself, being able to balance and reach for your soap and reach for your cloth, all of that is physical abilities that you need to maintain, to do it safely.
Some old people will talk about, a feeling of stiffness, not being able to execute certain movements because of stiffness. Your advice in that instance?
So when it comes to stiffness, it might be various reasons for it, but if it is due to a lack of movement, the way to fix it is moving, is to actually get moving and walking and reaching. If it gets to a point where it limits your function, then I would definitely recommend consulting with one of a physiotherapist maybe, or even an occupational therapist, to see if there's not an alternative reason for the stiffness.
Okay. Finally, Dr. Lipschitz, about, alcohol and other, at least we've touched on, abuse of pain medication. Yeah. The story around alcohol, is it a problem in the elderly?
Yeah, it's an enormous problem amongst the entire society. The problem with alcohol in the elderly is once again related